to the Agent Survival Guide podcast, and this is our Friday 5 for December 5th. I'm your host, Sarah Ruppel, saying rabbit, 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 and welcome to the month of December. Normally, we recap 5 of the biggest headlines from the week, but in the time since our last Friday 5, CMS published the 2027 Medicare Advantage and Part D proposed rule. So that is the topic we are focusing on for today's episode. Before we get into the list of my initial takeaways, just a note to keep in mind that this is proposed legislation. Nothing has been finalized just yet. In fact, some of what we're going to talk about today is CMS putting out what they call an RFI, or Request for Information. And then, of course, we are in the final days of annual enrollment, so I don't want to take up too much of your time with this episode. But there are takeaways here that gave me a little bit of an energy boost, so I'm hoping that will hold true for you as well. We'll start out with 2 quick mentions at number 5. Recently, CMS passed legislation reversing the Farm Bill provision of 2018. Beginning on November 26, 2026, the new definition of hemp goes into effect. The proposed rule offers some clarification around those changes, which mean that health plans still would not be able to cover cannabis as a special supplemental benefit for the chronically ill. According to the proposed rule, the new definition means that MA organizations could offer hulled hemp seed protein powder, and hemp seed oil, quote, as SSBCI to qualifying enrollees to the extent otherwise appropriate as SSBCI and under federal and applicable state law, end quote. Another quick note I want to add, mainly because we've talked about this in a few standalone episodes to date. CMS has already committed to the 2026 Part D provisions they plan to implement as a result of the Inflation Reduction Act legislation. For coverage year 2027 and beyond, CMS would like to codify select provisions via program instructions while they're still able to do so. That would mean a codified elimination of the Part D coverage gap, or the donut hole, as we call it. CMS would also like to codify the lower annual out-of-pocket threshold, removal of catastrophic phase cost sharing, and replace the coverage gap discount program with the manufacturer discount program, implementing the selected drug subsidy and several other operational changes. CMS calls the changes in this proposal, quote, the most significant transformation of the Part D benefits since the program's inception, and aim to reduce prescription drug costs for Medicare beneficiaries while maintaining program sustainability, end quote. Moving on to number 4, CMS has proposed a new special enrollment period, quote, to change plans when one or more of their providers are leaving their plan's network, end quote. Currently, this change can only happen after both the Medicare Advantage organization and CMS have decided that a plan change is significant. And then also SEP related, CMS plans to codify the current policy that, quote, certain SEPs require prior CMS approval, end quote. Those periods include the SEP for individuals disenrolling in connection with CMS sanctions, those who were not adequately informed of creditable prescription drug coverage loss, and the third, other exceptional circumstances. Next up at number 3, one of many requests for information, or RFIs, in the proposed rule. The first I'll mention, the RFI on C-SNP and I-SNP enrollment growth. The proposed rule notes significant plan growth in the number of dually eligible individuals enrolled in chronic conditions special needs plans between 2021 and 2025. CMS cites concerns that organizations may be using the C-SNP product to bypass the stricter enrollment requirements of the Dual Eligible Special Needs Plan, or D-SNP product. Because of that concern, CMS is exploring similar requirements for C-SNPs and I-SNPs, but before they do so, they are seeking more information and comments on the subject. Next up at number 2, and I have to say this is where things start getting exciting, another RFI. This one seeking to potentially change the current CMS definition of a third-party marketing organization, or TPMO. The current designation of TPMO can include a lot of different cogs in the insurance industry wheel, for lack of a better term. Some of us deal mainly with beneficiaries. Others serve as liaisons between the carrier and the agent. For me, I'm talking to agents, but also trying to inform agents of what beneficiaries need to know about. And then there are the different vendors we all work with on a daily basis. So to see that CMS is researching, quote, the roles and requirements applicable to the different kinds of TPMOs, end quote. To me, that sounds like CMS really is listening and trying to better understand the complex industry landscape. The proposal mentions that they want to be able to provide guardrails to stop bad actors, but also not put undue hardship on those who are following the rules. CMS also mentions being able to tell the difference between deliberate, misleading actions versus a mistake made in good faith. They're looking for suggestions on how to distinguish between those factors, whether more training could be beneficial, and how CMS might monitor progress in the future. I am very curious to read suggestions on how a TPMO hierarchy structure of sorts might play out, and if training is a suggested solution, what that training might look like. And then coming in at number 1, not a request for information, but a proposal to change how scopes of appointment are handled. And yes, that includes removing the cooling off period, so there would be no more 48-hour scope of appointment. In order to clarify their intention in this proposal, CMS also defined what they consider to be a personal marketing appointment. Anytime marketing is happening during a meeting with an individual, an agent must get a scope of appointment. But the scope of appointment must be obtained prior to the personal marketing appointment. Within this proposal, it would be okay if that happens just before you start the meeting. Again, no waiting period would be required. A personal marketing appointment would apply to a limited number of people that are either living in the same household or generally related. It's not necessarily defined by location, but that being said, if your entire book club decides they want to hear a Medicare Part D plan presentation in a small group setting, each one of them would need to complete their own individual scope of appointment prior to the meeting. Couple other changes here. CMS would remove the exceptions to the SOA rule that currently apply when a person initiates contact with the agent, is considered a walk-in, or meets with an agent in the last few days prior to their enrollment period ending. Every marketing interaction with an individual would require a scope of appointment. If the appointment happens in person, the SOA must also be filled out in person. And then if the appointment is held virtually, CMS is proposing that, quote, an audio or audiovisual recording or electronic record would suffice, end quote. Another change that I found interesting, CMS proposed removing the 12-hour delay between educational and sales events held at the same location. Agents would be required to take a break between the two events, inform attendees of the change, and give individuals the chance to leave. CMS cites the changes to event regulations much like the scope of appointment proposal. The expectation was that the regulations would provide extra protection for individuals enrolling in Medicare. In reality, the practice increased friction around enrollment. Now, I do have to add the disclaimer here that these aren't the only changes proposed by CMS. These are just my initial takeaways. There are other changes worth talking through, like the changes in star ratings and changes to Part D creditable coverage determinations for HRAs. We will be coming back to the proposed rule for a deeper dive in the near future. The Ritter blog will also be publishing a post on this, and we will be hearing from many more in the industry across the coming weeks. So stay tuned for more. Personally, I'm glad to be able to report on some good news for both agents and beneficiaries moving forward. I hope this gives you a little bit of a boost as we finish out 2025. If you have questions about the 2027 MA and Part D proposed rule, please send them our way. We would love to continue this conversation. Our mailbag is always open at asgpodcast@ritterim.com. But for now, I hope you have a great weekend. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Tina Lamoureux. Podcast design by Urban Rivera. Follow along with our show wherever you like to listen.